Welcome to this week's NIB News Update.
The National Insurance Board recently launched a series of public meetings on the National Prescription Drug Plan. In a meeting held for Northern New Providence, Algernon Cargill, Director of National Insurance, said he's very pleased with the progress of the plan thus far.
Very happy at the board with the success the plan has had. And when we launched the plan on September the 20th, we had approximately 10,000 registered beneficiaries of the plan. The number continues to increase and we're nearing the 14,000 mark, so the numbers of beneficiaries is increasing significantly. And based on that, we can see that we're providing access as well as reducing costs to thousands of Bahamians who no longer have to pay the medical costs of their medication as well as supplies that are covered by the plan.
Dr. Stanley Lalta, Project Manager for the drug plan, explained that the plan will help Bahamians to better manage their chronic conditions.
We've designed a plan in a way that it tries to deal with two major aspects of chronic disease. One, we recognize that there's a major problem already existing. How do we help these persons? And we call this the treatment component of the drug plan, where with better access to prescription medication, we will now enable persons to get their drugs at the right time, the right quantity, to reduce their expenses in having to pay for medication, and to improve their compliance with the prescription that their doctor would have given them so they can better manage their condition and overall improve their quality of life.
Dr. Lalta said the drug plan's benefits are currently accessible at numerous private and all public pharmacies throughout the Bahamas.
We have, through negotiations with both the public and the private pharmacies, tried to ensure that there's the widest choice possible. Persons can go to any participating private pharmacy or any of the public pharmacies to get their medication. We have contracts with 36 private pharmacies, 27 in New Providence, 4 in Grand Bahama, 2 in Abaco, 1 each in Eleuthera, Exuma, and Long Island. As we speak, there's another 2 which are lining up to join the plan, and so we do expect that we will have all of the private pharmacies as part of the prescription drug plan. At the moment, the number which we have here represents about 70% of the private pharmacies which exist in the Bahamas. And we have all of the public pharmacies, so there's a wide choice now for persons to go to get their prescription drugs filled.
During the meeting, drug plan pharmacist Lindisha Culmer presented the complete listing of formulary drugs and medical supplies covered by the plan.
A lot of questions came out over the past couple of weeks whether or not we cover all brand, all generic, or whether it's a mixture. Well, on the plan we have at least 50% are brand and the other 50% is generic. A lot of questions were asked whether the generics are good, do they work? Well, generics are just as good, and it is safe, and it's okay to take generic drugs. Generic drugs are similar or equivalent to the brand name drugs. They must pass tests before they are approved to be issued on the market. So a lot of our drugs have been proven to be effective and they are being used within the region.
Persons attending the meeting commented on what they learned.
The meeting was very informative. I'm happy I came because I really was under the impression that this particular plan was separate and apart from what's available through the government clinics and the hospitals. So now I know that if there is medication that they don't have available through the NIB plan, that they can still access the other source to get the medicine that they need. So quite happy that I came.
I found out that there are a select number of doctors who qualify to issue the prescription drug. Also, there are pharmacies that are available who are part of the program. There are different categories of illnesses, chronic illnesses, that people can partake in the prescription drug plan, and most of all, it's free.
For more information on the National Prescription Drug Plan, visit nibdrugplan.com or call 356-2070.